Hi, welcome to our Diabetes University, session number 15. Today we're going to talk about travel for diabetics. There are several points that are important to remember. Of course, the most important is that you must carry with you all of your important medications. So that's not only your insulin, your syringes, your oral hypoglycemic agents or incretin mimetics or whatever other medication you're taking for the diabetes, but you should also take your thyroid medications if you have hypothyroidism. And I recommend that if you're going to a part of the world where traveler's diarrhea is endemic, that you get your doctor to prescribe doxycycline. I believe the dose is 100 milligrams twice daily to treat traveler's diarrhea and 100 milligrams once daily to prevent it. You could also take Pepto-Bismol tablets with you. You'd have to pack quite a few because it may take a tablet every 20 minutes to cure traveler's diarrhea, or a tablet an hour to prevent it. Now, I suggest that of all the medications, syringes, etc., that you bring with you, you take duplicates. One set that you would put in your carry-on luggage, and a duplicate set that you take in your check-on luggage. The insulin vials, if you're using insulin or liquid medications, should have a prescription label on it with your name from your pharmacy. And you might want to play it safe and get a letter from your doctor saying that you're diabetic and have to inject insulin. That will justify the insulin syringes and also the bottles of liquid, because there may be restrictions on bottles of liquid. Now, I also recommend that you carry with you the emergency medications that we've discussed for vomiting and diarrhea, like low modal, including the liquid low modal, the Tygan, and so on. The Benadryl. Now, since Benadryl may come in a big bottle and the airlines may only permit small bottles of liquid, you might want to pour the Benadryl into two smaller bottles, one that you carry on and one that you check. If you really want to be meticulous, you might want to take with you a small bottle of hydrogen peroxide in case you get blood on your clothing. And since you don't need much, it could be a very tiny 2-ounce brown plastic bottle that will take care of your clothing if you get blood on it from a finger stick. Less likely from an injection, but certainly possible from a finger stick, because these finger sticks sometimes squirt. Now, to protect certain pharmaceuticals like insulin from elevated temperatures, which may occur in certain parts of the world, you probably should purchase Frio. Frio is a bag within a bag. The inner bag has pellets sewn in the lining, and that's the inner bag. And the outer bag is to prevent you from getting the inside of your luggage wet. What you do is you throw the inner bag into a sink of cold water and let it sit there for 20 minutes. And each pellet absorbs 100 times its volume of water. So the inner bag will look like it's loaded with sausages. And here's a small Frio for 1 or 2 vials of insulin. Large Frio. Now, you don't let the Frio sit in the water longer than 20 minutes because the sausages will get so big that there won't be any room for the medication in the bags. And the Frio will last you probably 1 or 2 weeks. The manufacturer says that at an ambient temperature of 100 degrees Fahrenheit, it will keep insulin safe for 2 days. Now, in my experience, this stuff keeps insulin cool for a week or 2, and it takes about a month for all of the water to evaporate so that you have pellets in the bags again. So that's the story with Frio. I tell people to also bring with them Sambucol, which is a preventive treatment for viral infections. I tell them it comes in a liquid or in a lozenge, and I say you get the lozenge. You suck 2 lozenges immediately before boarding a plane, because people are crowded, the air circulation is not complete, and many of the people will be coughing. So it's very easy to get a viral infection or another infection on airplanes. And the Sambucol is an antiviral. It's an extract of the black elderberry tree, and it's extremely effective, but only if you take it within 3 hours of exposure. So I tell people, take it before you board the plane, and once you're on board, if the flight is more than 6 hours, you take it again, because the Sambucol should be taken every 6 hours if you're continually exposed. If you are injecting insulin or taking basal medications, as you might do with long-acting metformin, extended-release glucophage, you want to modify the timing of your basal medication so that it more nearly matches what the timing will be when you get to your destination. So if your destination is going to be 6 hours later, if the time is going to be 6 hours later than it is from the point where you left, then you might want to take your shots or whatever 3 hours later than you usually would. And if your destination is 6 hours earlier, you might want to take your medication 3 hours earlier. And if your blood sugars go too high because you've delayed the medication, you might want to use rapid-acting insulin to bring the blood sugars down. If they've gone too low because you've taken your shots too close together, you could use liquid glucose or glucose tablets to bring your blood sugars back up. Of course, all this assumes that you're measuring your blood sugars. I think I've covered just about... yes, one more minor warning. If you're taking doxycycline and you have fair skin, it will predispose you to sunburn. So wear a hat if you have fair skin and are taking doxycycline. There are other medications or antibiotics that are good for traveler's diarrhea, but I don't like to recommend them because they can increase hazards for side effects. Azithromycin can increase the risk of Clostridium difficile infections of the intestines, which can be very serious and even fatal. Cipro and its related antibiotics, which also can be effective, can increase the risk of rupture of the Achilles tendon, cataracts, possibly glaucoma. So I feel that the doxycycline is pretty safe. That's a good summary of preparation for travel. And have a good trip, and we'll see you at the next session. Thank you. The bulk of what you've heard on this video appears in my book, Dr. Bernstein's Diabetes Solution, which is available at most internet and local bookstores. It is published by the Hachette Book Group. I'd like to remind you that we have monthly free teleseminars every month at the site askdrbernstein.net. Doctor is spelt DR, so askdrbernstein.net for a free monthly teleseminar. Sign up a day or two in advance so that you get a reserved seat. Good luck, and thanks for listening.